Today I want to talk to you more about overuse injuries. Overuse injuries, we're talking more about sports-related injuries today, and that's going to be some examples are swimmer's shoulders, runner's knees, pitching tendonitis. All this stuff is really considered overuse in origin, and I'm going to show you an example of what I usually show my patients. They really seem to get it at that point and really understand what's going on with their injury. So what we're looking at really with soft tissue overuse injuries is balled up tissue from scarring. Okay. The analogy that I've been using is actually went to Hawaii not too long ago for one of the Ironman events. We stopped by one of the other islands and saw lots of chickens. We were out there. One of the lifeguards was biased, so I talked to him and I said, "Hey, look, you guys must, never really have any problems with eating. You can always grab a chicken and cook it up and stuff." And he was telling me no, that no one really eats the chickens there because they're really gamey. They're really tough meat. Now, contrasting that to veal really doesn't do much, and as a result, not very gamey, not very tough meat. So the analogy that I use with people is I use this mop. Okay, every new patient that comes in, they see this mop, so they know what it is. So normal tissue should actually be like the top of this mop here. It should be free-flowing. It shouldn't stick. The fibers shouldn't stick to anything. These all pretty much represent muscle fibers or sections of the muscle. Now, what happens is when you overtrain a muscle, it eventually tears. Small tears called MicroTears. MicroTears are fairly common in endurance athletes, team athletics as well. But basically what you have is you have sections of this muscle that actually rip and heal over with something called scar tissue. Scar tissue it's not the same as normal tissue. It's not very pliable. It doesn't like to bend. It doesn't stretch. Basically, as a result, this section of the muscle becomes non-functional. It doesn't work quite as well. It's not as strong. It's relatively weak. So what happens is the rest of this muscle actually picks up the slack and can develop some of the scarring as well from some of the small tears. So eventually, because it's called a cumulative trauma disorder, it doesn't really start. It starts at one spot, but it keeps growing and growing and growing. It's a compounding problem. So eventually, you get something like this, where the whole section of the muscle doesn't actually work anymore. This is where you start coming in, and this is where you start saying, "Well, I can't pitch anymore." Reality of it is, you can stop a lot of these problems before they start if you know the proper preventative techniques. You can stop it when it gets to here, or you can wait all the way until it gets to something like this. But at this point, you're on the bench. So really, the fix is that you have to go in and you have to break some of the scarring out. This is not function. It's not going to work well for strengthening. Resting it is not going to do anything. Basically, you have to actually mechanically go in there and break it out.